Hi, and welcome back. This is Center Radio, now Center Webcast, COVID-19 update in Indiana. This is episode 4 in this new series. Today's Thursday, April 2nd. We are streaming live on Facebook, recording the Zoom meeting, and it'll be available later for broadcast. I'm excited to be joined today by our regular co-host, Dr. Sybil Moore. Today's guests are Stephen Wolf, President and CEO of IRMC, Jessica Dean, Executive Director of the Care Center, Linda Mitchell, Executive Director, Downtown Indiana, Senator Joe Pittman, Pennsylvania 45th Senate District. Thanks to Dr. Brandon Vick, who is on our Facebook and Zoom production, and special thanks to Candace Bolger, who did a little bit of research today looking at shopping. So the Center for Community Growth is a local organization. The mission is to lead individuals and organizations in Indiana County advancing racial, social, gender, LGBTQIA, economic, and environmental justice. COVID-19 in Indiana County is a new regular broadcast designed to keep you informed in the coming weeks about the COVID-19 pandemic. We hope this remotely produced broadcast will help you understand how this pandemic is impacting you and the Indiana community. We'll be coming at you Sundays at 2 and Tuesdays and Thursdays. Each episode will be available for replay. I'm excited about our first guest, like the President and CEO of the Indiana Regional Medical Center, Stephen Wolf. Welcome, Stephen.
Gerald, thanks for having us.
Great. I want to get right to it. I've been hearing from a couple of folks regionally in terms of what are resources for folks who are living through the quarantine. What I think a lot of folks are really wanting to hear from our regional hospital is how are we doing there? We're hearing lots of personal reports from healthcare workers across the country and even neighbor in New York City who are describing these scenarios that we are all fearing, which is a healthcare system that seems really on the brink. And we are hearing stories about personal protective equipment not available, testing very hard to come by, and reports that people are being sent home with symptoms of COVID-19 without a test. As the region's real central medical facility, can you tell us where we are in Indiana County? How is testing being done? Is it increasing? Does the hospital have what it needs as we face this pandemic here locally?
Well, first, I just wanted to try to give a message of encouragement to the listeners today that, we're going through an extraordinary journey together, but there is a lot to be thankful for and positive about. And certainly the overwhelming majority of the people are going to get through this crisis fine. And we are testing people, and I'll talk more about that, but the overwhelming number of those tests are coming back negative. And for the majority of people that are testing positive in the region, they're doing fine. It doesn't change that there aren't vulnerable portions of our population and that we don't need to be worried about that, but we really are grateful for just those facts, and also that the community outpouring has been incredible. I mean, to have so many local businesses that have been donating needed supplies, and you're seeing heartwarming stories of groups getting together to make masks, individually working, but pooling to do that. Elderly group I know that's working on that. We have a high school kid at Homer City who's making face shields. And you're just seeing, this heartwarming story and the outpouring and just the faith that people have that we're going to get through this as a county and a state and a nation, and that God's still in control. We're also blessed with a lot of ingenuity in our industries here, and people are working around the clock to develop medicines and treatments and vaccines. And so, we're got a lot of good things going on here to be positive and hopeful about. To get to your question, we have been blessed, Gerald, with this really taking longer to get the Indiana Regional Medical Center. So it's given us an opportunity to get some supplies around that perhaps some of the hospitals that were impacted earlier were unable to do, and even still in parts of the country, they're struggling. We're staying anchored to the CDC guidelines. So we have a group that's meeting 7 days a week that's really guiding us through this. And we have met the CDC guidelines and providing all of our personal protective equipment for our employees. And whenever we're able to exceed that, we're doing that. So we are working hard to do that. You know, like every hospital really on the planet, you wished you had more you could do. And so, you know, we have that, and we want to continue to strive. And it really is a top priority. I myself, as CEO, I'm probably spending 1 to 2 hours a day personally trying to get protective gear for our employees, physicians, and community, senior team members. So it really is a big priority. Just to paint a picture here, you know, in Louisiana as we speak, where they're really having the crisis kind of go in their community with it spiking, you know, there's providers and employees that are providing care in the midst of that with no mask at all. So we have a lot to be grateful for, and we're blessed. You had asked about testing. The testing kits have been very limited. So that's been a bit of a disappointment as providers that we don't have more of those tests, and they've really been reserved for our sickest patients and when we need to know whether we have that positive COVID diagnosis or not. But good news is that that's starting to break, and I think we'll be able to do a little broader testing. Certainly our goal is that we can do much broader community testing and would like to do that, but we just haven't been able to do that at this point yet.
Can you, if I could follow up, can you tell us a few numbers about the updated numbers? Now, we've been following in this program just the number of positive cases in the county. I think 2 days ago, I think the update, there were 6 positive counties. Can you give some more context around those numbers? Is that out of, you know, about how many tests have been given? You know, is that testing process, is that being streamlined? There's a lot of, you know, there are at least rumors, and there are stories that folks hear about the testing process being kind of lengthy, and things need to go away for a while and come back. How are we doing it in terms of those numbers, and how streamlined can that process get?
Sure. So the latest information just today is we've had our 7th case in the county. So that's where we are with that. As far as testing, it's a little hard to know what the total numbers are. 2 of those 7 we never saw. So they must have gotten tested somewhere else, and that's all reported to the Department of Health. So there is testing going on outside of us. And so we're not really sure what the total N size of that is. But I mean, as far as the turnaround time, it has been frustrating to the providers. Initially, all tests were going to California, and they were taking a week or a week and a half. And actually, I believe we have some tests that aren't even back. I mean, once you get beyond 14 days, the test result is essentially irrelevant. Then we got to go to a Pittsburgh lab, and initially we were getting pretty quick turnaround, but as the testing's ramping up, that's now slipping. So we were getting 24-hour results. Now that's running kind of more 3 to 4 days again. So, you know, it's hard on a patient and a family to be waiting that long. They might be out of work until they get a negative result. So we're doing everything we can to bring this testing inside. And so we're hopeful that we'll be able to do this testing within the hospital soon, and that we can have turnaround times of like 4 hours. So we're just not quite there yet, but getting close.
Okay. Would you characterize the current cases in Indiana County as due to community spread, or are these still cases which can be traced back to a particular origin, somebody traveling from outside the region, for example?
That's a great question. And, you know, we're certainly not the experts at the CDC or the Department of Health are, but our Chief Medical Officer, Dr. Bruce Bush, believes that we have reached the stage of community spread, that we are seeing examples of that being spread between people within Indiana County. And so it is a really critical time over these next couple weeks to be vigilant and to really do everything that you can to protect yourself and you know, whatever social distancing you can do. We realize that people need to get back to work, and So there's a whole host of issues there, but just to be alert that, it's in the community and how this is going to progress, at what speed and what severity is really going to be in the next several weeks will be really big for that.
If I could do another follow-up there, and I would like to ask a few more questions about what you're seeing at IRMC, but in terms of businesses that are staying open, obviously we want to make sure our healthcare workers are supplied with the kind of personal protective equipment that is needed. Other businesses that are essential, if there is community spread, is it wise to ensure that any essential business has the kind of personal protective equipment that we have in a healthcare setting, at least to make sure if folks want to be sure they're protected through community spread before they go home, or if they themselves are perhaps carriers, as we know this virus is proceeding, is it a recommendation that folks that are essential workers and staying open should all be, at least have personal protective equipment available?
Well, I think, for gloves and those type of things that they're clearly, recommended. I don't believe there's any general provision for masking in the community like that. So I don't know that that level would be required. Hopefully if somebody has a fever or they're exhibiting any symptoms, they're not coming to work and staying home. I think if you're on the receiving end of one of those businesses, products, you want to just make sure that you're using common sense protocol to try to, if you can wipe something down, to do that, but to make sure you're just washing your hands good before you put them in your hands, nose, and mouth and eyes. So, but as far as I know, just the gloving would be, I think, the main thing, but that's not my area of expertise.
Great. Well, I do want to come back and just ask a few questions about how IRMC has been impacted, particularly. We're hearing again about hospitals in a lot of regions that are receiving a surge of patients. Is IRMC seeing a surge of patients with symptoms similar to COVID-19, the low fever and cough? I guess the question is, what's your capacity been over these last weeks? And are you prepared for a surge?
Well, I think right now we have plenty of capacity, although every day we have quite a few people coming to the emergency room or urgent cares, which are open for business, and anybody that would exhibit any of the symptoms that would be screening, we would have them basically be taken into a negative pressure room and given a mask, and then we would do that examination. And so we're sending out COVID tests every day. There's a segment of that population that's being tested every day. And we do have some inpatients currently that we're waiting for results on tests. And those are, being kept in a negative pressure isolation room as we, await that and we care for them. So we're good right now. I think, as the leadership, we're trying to think about 7 areas of focus, the clinical care that we need to provide, secondly, public safety, third, our employee and physician safety, fourth, communication, both internally and externally. And then fifth, is an employer of nearly 1,500 people. We have employer issues like all businesses do. Sixth, our financial stewardship, and then 7, scenario planning. And so to your question of surge and being ready for one, we believe there's 3 or 4 models that might play out here. Now that we have community spread, we think in 1 to 2 of those models we'll be able to get through that if it's spread out over a period of time. If not, we are making arrangements to work with PEMA and other entities within the county here, where patients, if we would overrun the hospital, I think it could happen. Don't think it's likely to happen, but it could happen, that we would be prepared for that worst case scenario if it is. So I feel like we're doing everything that we can to be ready for a surge, but it certainly has not happened yet.
That's great. That's great to hear. We talk a lot on this program about flattening the curve, and you mentioned that we have been a little bit, I guess I would say, lucky in terms of diagnosed cases. We have, it's disappointing to hear we have 7, but how do you think this community is doing in terms of taking those precautions that we need to in terms of social distancing, et cetera, to flatten the curve? Are you seeing any numbers that would indicate that we're we're doing a good job here.
I think there's no question that from a health care point of view, that the social distancing is making a difference. And American people are resilient, and they rise up in times of challenge. And I think Indiana County should be proud of the citizens and their effort on that. And so I think it's definitely making a difference. I think it is flattening the curve. I think these next 3-4 weeks are going to be really critical. At some point, something's going to have to give on getting people back to work and school, and we understand that. And then just trying to be as vigilant as we can, because we believe this is a marathon, it's not a sprint. This is going to be around in the community for some period of time.
That's great. Can I ask, so the community, like you said, really wants to help out. What's the best way that the community can reach out? I've seen folks, we have a local hero there we talk about who's involved in this program. Judy Holliday has made probably 1,000 masks. Now, I don't think they're the N95 masks. I think they're one of these home kits, but she has a huge demand for them. How can community members who are at home, like you said, the story with the 3D printers and the masks in Homer City is a fantastic story. Other folks have 3D printers at home. How can the community sort of support IRMC as we approach this?
I do think that just whatever supplies people can provide. I mean, the supply chain issues are still real. And, if people can donate masks or gloves or gowns or face shields, and honestly, the N95 masks, while they are very critical when you're with very sick patients, just that general surgical mask is a cornerstone to what we need, and something that, we could use. So I think any of those we are creating through the foundation, an employee fund. So, I know it's a tough time for people to think about making financial donation, but that's a possibility. It'll go into an employee fund, as these people are standing in the front lines and putting themselves and their families at risk. And, there's going to be inevitably times where we have, people that are forced to go into quarantine or perhaps get, sick in terms of that. But I would just say that if you would want to ask how you could better help the hospital, if you could call the marketing and public relations at 724-357-7188. That's 724-357-7188. We could give you then an up-to-date exactly what the biggest needs are, because it's changing daily.
Great. Is there a spot on IRMC website where folks can keep up to date as well? I think we had up you've got a page.
Yes, it's on the IRMC website.
Great.
We have a location.
Thank you. Thanks, Brandon. Found that. Okay. Great. Well, I want to thank you quite a bit. Is there anything else that you want to let folks know that we haven't covered here in terms of what we're facing?
Yeah, I guess we just would encourage people to really take serious the social distancing during this time. And I know it's hard, but it really is making a difference. And we would just stay vigilant during this time, and just to, try to stay positive, to remain calm, just to realize it's a marathon, not a sprint, and just that, continue to keep faith that God's out ahead of us here. And I appreciate the opportunity to be on the show, and really respect what you're doing to try to keep our community informed. Thank you.
Sure. Well, thank you. Will you come on again maybe next week and give us an update on where we're at?
I'd be honored to join.
Fantastic. Thank you so much.
Thanks,
Stephen Wolf, CEO and President of IRMC.
Thank you.
Right back.